Greetings, acupuncture gynecology patients, endo warriors, and acupuncture friends. It is Dr. Stephanie hopping on to chat with you for a bit. I realize it's the end of January, but I wanted to chat with everyone today about January being National Blood Donor Month. If you're new to my page or practice and don't know anything about me, I have endometriosis, and that had a great deal of influence on the direction I have taken for my practice throughout the years. So what exactly does this have to do with National Blood Donor Awareness Month? I've had a number of surgeries over the years to manage my endometriosis, starting with the first one when I was 28, when I finally found a doctor who was willing to work with me and do the laparoscopic surgery to diagnose the endometriosis. But in July of 2017, I started hemorrhaging, and I went into the doctor and they did blood work and my hemoglobin was normal, and they gave me progesterone, and it wasn't doing anything. It wasn't stopping the hemorrhaging. And day after day, I kept calling them, and the office would reply, "You can come in and we can do blood work again and we'll tell you if you're anemic." And I was like, repeatedly calling and just saying, "Just tell me how you can stop it." And I don't know if they thought I was casually using the word hemorrhaging, but I was hemorrhaging. It was not an understatement. I just couldn't stop it at all. So finally, after 2 weeks of me calling, and really the only days I wasn't calling was the weekend because I wasn't going to get anyone on the phone, I finally said, fine, you know what? I'll come in. You can tell me that I'm anemic. I already knew I was anemic. And I showed up at the office and they immediately called an ambulance and they took me to Robert Wood Johnson, New Brunswick. And when they did my hemoglobin level there, it was a 3. So I don't know if you know anything about hemoglobin levels, but normal is about a 13. 3 is not far from being dead, and that was what my GP told me when he saw the blood work afterwards. And when they do transfusions for something like that, they're not transfusing everything back. He was like, I want you to look at your blood work for the day that they released you so that you can see that the blood that they put back into you just stabilized you. So I needed an emergency hysterectomy, which, as an aside, is not a cure for endometriosis. So if someone is telling you it cures it, it does not cure endometriosis. There is no cure for endometriosis. And there are parts of this story that I'm going to leave out because it's just better if I share them at another time, because this is really about, it being National Blood Donor Day. So in order to operate, I needed blood and I needed it fast. And as they did do infusions, and as quick as it was going in, it was kind of going back out. So I'm AB positive, which makes me a universal blood recipient. And I ended up receiving a little bit of everything. I got some A, some B, some AB, some O blood. It was quite the mix. Prior to them actually being able to operate, I received 6 bags of whole blood and 2 bags of platelets. So basically, a lot of people saved my life that week, because whole blood, each bag comes from one person, and platelets can either come just from one person or they are made up of donations of 5 whole blood donations to make up a bag of platelets. I do realize that, donating is not for everyone, but if you consider it, you will be saving someone's life, someone like me. More than 6 people made it possible for my children to have more time with me. More than 6 people made it possible for me to celebrate 3 more trips around the sun since all of that happened. Whoever those people are, I am so grateful for the gift of life that they gave to me. Of course, I wish that the staff at the GYN's office had taken things more seriously. If you could have seen the look on their faces when I walked in, it looked like panic. I don't think that they thought that it was as bad as I was saying on the phone. And I think like my own GP knows that for me to ask for help, I'm at the brink of really needing help. Um, I have donated blood and platelets myself in the past, but 2020 was the first year that I was able to donate. The surgeries took a lot out of me. There was more than one surgery. I had a bladder tear, and like I said, I'll share more about that at another time. And they did have to transfuse blood during the surgeries to keep me stabilized. Um, the recovery from those surgeries was long. I'm sure it would have been better if I hadn't hemorrhaged for those couple of weeks, but I am super grateful for the people who are the blood donors that saved my life. So if you can, go save a life. And I just wanted to share all of that with you because it is National Blood Donor Awareness Month. Take care. Have a great day. Don't forget to like, follow, subscribe on all of my different pages. You can get on my email list by following the link in bio, and that'll give you what's new and going on all the time. Take care and be well.